This skill is trach suctioning. Wash hands, knock knock. Good morning, my name is Xavier. I'll be your nurse for today. Is it okay if I check your name band? Miss Smith, nice to meet you. So I'll be providing you trach suctioning. Is that okay with you? All right, so I'll be back with the supplies. So I'm going to wash my hands and gather the supplies. Confirm the length of the tracheostomy tube. Apply non-sterile gloves. And apply a pulse oximeter. Check vital signs, baseline oxygen saturation level, and heart rate. Evaluate the client for signs of airway obstruction or hypoxia. Ms. Smith, I'm going to raise your head up. So move the patient in a semi-fowler's position with their head slightly hyperextended. Stand on the side of the bed that supports the use of the dominant hand. Ms. Smith, I'm going to place a towel over your chest. Check that the suction device is functioning and set to 80 to 120 millimeters of mercury for adults and 50 to 100 millimeters of mercury for children. Connect one end of the tubing to the suction machine and place the other end within reach. Perform hand hygiene. Open the suction kit following the sterile procedure. Put on gloves and squeeze the water-soluble lubricant into the sterile field. Pour approximately 100 ml of sterile water or saline into the sterile basin. Discard gloves, perform hand hygiene, and then apply sterile gloves. Pick up the suction catheter with dominant hand and maintain sterility. Hold the suction tubing with non-dominant hand and connect it to the suction catheter. Place the catheter tip in the fluid in the sterile basin and apply suction to check the connection. Ask the other clinician to hyperoxygenate the client. Follow facility protocol or provider orders and confirm with the pulse oximeter reading. At the end of a client inspiration, maintain sterility while quickly and gently inserting the catheter into the tracheostomy tube to the predetermined length. Do not apply suction while inserting the suction catheter. Insert suction catheter to the predetermined length of the tracheostomy tube. Intermittently apply suction while withdrawing and rotating the catheter for 10 to 15 seconds for adults. Discontinue suctioning if the heart rate decreases 20 per minute or more from the baseline. If needed, oxygenate the client with a bag valve mask for 30 to 60 seconds or encourage the client to take deep breaths. Evaluate client's oxygen saturation, heart rate, and respiratory effort. If necessary, repeat suctioning as needed. Rinse the catheter between passes by suctioning a small amount of sterile water from the basin. Repeat suctioning until the oxygen saturation levels return to baseline. When suctioning is complete, disconnect the suction catheter from the tubing. Dispose of gloves and PPE. Turn off the suction machine, clean up the supplies, and perform hand hygiene.